Bowel cancer. 7 symptoms that demand immediate attention. Is your bowel doing its job properly, or is something wrong? Sadly, colorectal cancer is incredibly common and often deadly. That's why knowing the warning signs is so crucial. It could save your life. Today, we'll delve into the 7 alarming indicators of colorectal cancer. It's crucial to be informed about this disease as it ranks 3rd in prevalence and 2nd in mortality among cancers, accounting for roughly 10% of all cancer fatalities. So keep watching. This video is divided into 2 segments. The first highlights the visible and tangible signs of colon cancer, while the second, arguably more vital part, discusses preventive measures. I'll cover lifestyle changes, dietary choices to fend off the disease, and the rise of colon cancer in individuals under 50. This will be an extensive discussion, so stick around till the end. And I'm curious, do you know someone affected by colon cancer? Where are you watching from? Drop a comment below. Let's dive into the 7 warning signs that suggest your bowel might be in trouble. Symptom 7. Alterations in bowel habits. Understanding your bowel routine is essential. Whether you're someone who visits the restroom post-breakfast, multiple times daily, or just a few times weekly, it's vital to recognize your pattern. Any deviation in your bowel movements should raise an alert. While changes are normal, persistent or worsening alterations warrant a doctor's consultation. Approximately 65% of individuals with bowel cancer report such changes, which can manifest differently based on the tumor's location, size, and stage. You might notice variations in stool consistency or color, increased frequency, or the opposite. A significant shift, especially alternating bouts of diarrhea and constipation, should prompt caution. Symptom 6. Blood in the stool. It's imperative to inspect your stools before flushing. Bleeding can differ depending on the colon section affected. The right side, comprising the ascending colon, is broader, and its contents are more fluid, leading to less obstruction but potentially more bleeding, resulting in dark, tarry stools with a distinct odor known as melena. Conversely, the left side, including the descending and sigmoid colon, produces more solid waste, where bright red bleeding might be noticeable post-evacuation or on toilet paper. While other conditions like hemorrhoids or dietary factors can cause similar symptoms, it's critical to rule out serious concerns. Any degree of blood presence in stools should be investigated, as it could signify a tumor causing ulceration or bleeding. Symptom 5. Abdominal pain. If you're suddenly plagued by severe recurring abdominal cramps or pain during defecation, particularly if you've never experienced such discomfort before, it's time to seek medical advice. These pains could stem from dietary changes or gas buildup, but persistent pain without apparent cause may indicate bowel cancer. Symptom 4. Persistent fatigue and weakness. We're not talking about the weariness from a poor night's sleep, but a profound exhaustion lasting weeks or even a month. In colon cancer, this fatigue could be attributed to hidden anemia caused by the tumor's slow bleeding. If you're eating well, yet still feel drained and show signs of anemia, it's essential to explore colorectal cancer as a potential cause. Cancer cells rapidly dividing can deplete your energy and nutrients, exacerbating fatigue and chronic weakness. Symptom 3. Bloating. Frequent or unusual bloating and abdominal swelling are common symptoms of colon cancer. This could be due to a partial or complete blockage in the bowel, leading to gas and stool accumulation. Additionally, the tumor might obstruct food and fluid passage, contributing to bloating and colic-like pain. While bloating can have various causes, it's advisable to consult a doctor if you experience persistent bloating. Symptom 2. Unexplained weight loss. If you're not dieting, yet notice a significant drop in weight, for instance, from 70 to 65 kilos, without changes in diet, mood, or exercise habits, it's a cause for concern. Colorectal cancer can impact nutrient and calorie absorption, mimic a parasitic effect, or increase the body's energy demands, leading to muscle and fat loss. It can also obstruct the digestive tract, causing nausea and vomiting. Symptom 1. Tenesmus. Before we proceed, please take a moment to like and share this video. Your engagement helps us reach those without access to medical care. Now, on to our most crucial symptom, tenesmus. After using the restroom, you might feel as though not everything has been expelled, compelling you to return. This sensation of incomplete evacuation, even when the bowel is empty, is a telltale sign of bowel cancer. The tumor's partial or complete blockage can create the illusion of remaining stool, which is, in fact, the tumor itself. Remember, these symptoms alone don't confirm the presence of cancer, but they do necessitate a thorough checkup. Share your thoughts and experiences in the comments, and let's continue the conversation. What are some risk factors for colon cancer? The risk factors for colon cancer can be categorized into those that are modifiable and those that are not. Here's a summary. Modifiable risk factors. Diet. A diet high in red and processed meats and low in fruits, vegetables, and whole grains can increase the risk. Weight. Being overweight or obese, particularly carrying excess fat around the waist, is associated with a higher risk. Physical activity. A sedentary lifestyle with little to no regular exercise can raise the risk. Alcohol and tobacco use. Moderate to heavy alcohol consumption and tobacco use are linked to an increased risk of colon cancer. Non-modifiable risk factors. Age. The risk increases as you get older, with most cases occurring in people aged 50 and older. Personal or family history. Having a history of colorectal cancer or polyps, or a family history of these conditions, raises the risk. Inflammatory bowel disease. Conditions like Crohn's disease or ulcerative colitis can increase the risk. Genetic syndromes. Inherited conditions such as familial adenomatous polyposis, FAP, or hereditary non-polyposis colorectal cancer, Lynch syndrome, significantly increase the risk. It's important to note that having one or more risk factors does not mean that a person will definitely develop colon cancer, just as some people with no known risk factors can still get the disease. However, understanding and managing these risk factors can help in prevention and early detection. Regular screening is recommended for those over the age of 50 and for those with a family history of the disease. So you might ask, how can I reduce my risk? Reducing the risk of colon cancer involves a combination of lifestyle changes and medical strategies. Here are some key steps you can take. First up, get screened. Screening is one of the most effective ways to prevent colon cancer, as it can detect precancerous polyps that can be removed before they turn into cancer. Maintain a healthy diet. Consume a diet rich in fruits, vegetables, and whole grains. Limit the intake of red and processed meats, which have been linked to an increased risk of colorectal cancer. Stay physically active. Regular exercise is associated with a lower risk of colon cancer. Aim for at least 30 minutes of moderate activity on most days of the week. Manage your weight. Being overweight or obese increases your risk of colon cancer. Work towards achieving and maintaining a healthy weight through diet and exercise. Limit alcohol and avoid tobacco. Alcohol consumption should be done in moderation, and tobacco use should be avoided altogether, as both are risk factors for colon cancer. Consider genetic counseling. If you have a family history of colon cancer or other risk factors, genetic counseling might be recommended to discuss testing for hereditary cancer syndromes. By implementing these measures, you can significantly reduce your risk of developing colon cancer. It's also important to stay informed about any new recommendations from health organizations and to consult with your healthcare provider for personalized advice.